Please, TeamD.
Okay, thank you. And thank you, Team Adidas, Bluebirds, and Colorful. I think this is the last day of the JTAP workshop, but I think the workshop will initiate your journey of teamwork for cancer patient care, and followed by the clinical public health research project will be the education on telemedicine for medical staff from TeamD into EduCare. And I know they are nervous right now because we just finished the presentation slide this morning. But this morning, we all know that they discuss with joy and a smile. So I know they have a good progress. So let's welcome the last team, TeamD for EduCare project. TeamD, please.
Okay. Hello, everyone. Now we will begin the presentation of TeamD EduCare. So next, please. So, okay. Gap in region, environment, experience, information, and opportunities for consultation are barriers for healthcare professionals to improve the quality of cancer care. So we consider this issue by focusing on the education of healthcare professionals through telemedicine. Next, please. The problems of disparities among medical professionals directly affects the quality of care and psychology of patients. On the other hand, if we educate healthcare professionals and eliminate the disparity, cancer patients can receive correct and useful information and support. So with this in the background, we named our team EduCare and come up with our mission, vision, and team project. Next, please.
First is our vision based on background mentioned above. We decided that our vision would be we will eliminate the gap of care for cancer patients through telemedicine education for medical staff. This was a topic that team members discussed and deliberated on many times. We wanted to provide our patients with the best care possible, no matter where they lived. We thought about the education of healthcare professionals to achieve this goal. Thinking about the best care for patients, we realized that the best care for patients means not only providing the latest treatment and correct information, but also being able to provide patient-centered medical care tailored to each individual patient's situation. We wanted to eliminate that gap. Next, please. Next, we discussed our mission based on the vision and decided we will create the telemedicine system offering interactive online consultation and lecture with medical staff in order to improve the quality of cancer care and to achieve patient-centered care everywhere. We believe that in order to eliminate the gap in medical care for cancer patients, we need a tool that can be used by as many medical professionals as possible at any time in their place, where medical professionals can exchange information and consult with each other rather than just providing one-way knowledge. And we have made it our mission to build such a system. Next, please.
We will create the application called EdCare. EdCare comes from the team name. The purpose of EdCare is illuminate the gap of care for cancer patients. This icon was created by Kentaro. We choose the application because it's always accessible. Next slide, please. Application concept, purpose to illuminate the gap in knowledge and experience of medical staff on cancer care. How to achieve the purpose to offer an opportunity of communication with peer and lecture from experts. Use and education target group, medical staff all who are interested in cancer care but do not have enough opportunities to improve their skills. Next slide, please.
We will introduce two contents from nurses for medical staffs. Chat space and daily care pages enable us to consult or obtain information about daily care which patients frequently ask nurses. We can provide information and patient-centered care by these contents, and we believe it leads to improving patients' QOLs. In the chat space on this slide, medical staff can freely consult with specialists wherever we have any concerns. Whenever we have any concerns about cancer patients' care, including nutrition, appearance, aid medicines, health insurance, and other caring issues in daily life. And collaborating with companies regarding daily care and life skills is, for example, in appearance care, we can share patients and medical staff needs with cosmetic companies, or collaboration for preventing work-related injury. And we can connect society and companies with patients and medical professionals. Also, through the chat space, we can improve knowledge of social resources and the service that can be offered to patients. Next slide, please.
I would like to continue by the daily care page. And to make sure that users will not receive fake news, we will provide them accurate information and knowledge, not only about symptom management, but also about social support resources. And just one click on the topic for more details. The information will be updated regularly for the users to access, and we will consider bringing necessary answers from the chat space into this daily care list. And nurses should review this page to know whom to consult, depending on the nature of the consultation. And I hope medical staff will find these contents helpful somehow. Next slide, please.
This is the pharmacist's idea for the EduCare project. The most important thing is sharing education. So we share teaching experiences and methods about cancer patient care and share case study discussion. This can be helpful where communication is needed, such as community pharmacists and hospital pharmacists. That way, we can share this through online discussions and records through the application. This has impact on leading to safe, satisfactory, and effective treatment for patients based on improved knowledge of medical steps. Next slide. For example, Q&A part, It can be sharing information, IV or oral therapy, and monitoring side effects of newly developed anti-cancer drugs, and side effect management like skin care, monitoring of renal function, and immune-related adverse events associated with immune checkpoint inhibitor. Next slide.
As a patient idea, we newly provide an Ask Doctors content, which can offer an on-demand online consultation system. In this content, we can post our problem in the cancer care on the bulletin board like this. For example, I have a 68-year-old breast cancer patient with bone metastasis. I cannot decide the next chemotherapy regimen. Could anyone discuss this issue in the virtual meetings? And we can set up a meeting button like this. And then using this hashtag, AI or artificial intelligence detects the peers who may be able to discuss the issue and send invitation of the virtual meeting to the candidate. And then we can make, like this, we can make an on-demand online meeting with peers who have the same interest. Using this application content, we can have an impact that we can offer opportunities of education to the physicians, particularly who cannot consult anyone due to the lack of human resources. For example, in the small hospital or so. Yes, that's it. Deacon-san, please go ahead.
Oh, I'm sorry. Dr. Ding has problem with connection, so he's cannot join. Kentaro, can you continue?
Oh, I tried. We discuss the possible challenge and problem while running this application. First, budget problem. It may be solved by the sponsorship from pharmaceutical companies or crowdfunding, tuition fee or so. A next possible problem is other requirement, official platform, equipment, rooms, and we can be solved by. If the design come back.
Yes.
I'm
sorry, or because my internet is unstable. Yes.
Please go ahead.
Yes, thank you very much, Dr. Kintaro. Yes. Now I would like to present about the intrinsic challenges. Firstly is the budgets. Budgets is very important for running the project. So our team solve this difficulty in budgets by the sponsorship from the pharmaceutical companies, crowdfunding, or tuition fee, especially with the learner who have a desire to receive the CME or certificate. And the second challenge, the second intrinsic challenges is is related to equipment, the room and official platform, and we will also will have a proposal to hospital leader to solve these challenges. And second, the thirdly is the potential problem related to the disclosure of patient personal information, especially during the online consultation. So our team will not disclose the name and photo of patient during the online consultation. Next slide, please. Yes. And now I would like to present about the intrinsic challenges that related to the teamwork building. The first difficulty is difference in language between among each team member. Yes, it's the first time we have difficulty in communication, but luckily we have the translator from mentor, tutor, and other participants of our team, and have a Google Translate is as a useful tool. And I also give a thank you to all of member and tutor for your support timely and professionally. The second challenge is the difference in time zone between Japan, Korea, Vietnam, and Taiwan. So it's the first time we also have the difficulties in setting up the schedule for virtual meeting, and this problem was have been solved by creating the survey about the most feasible virtual meeting schedule that prefer for most of members. And the second difficulties is the similarities in personality. What a surprise! 7 per 9 members of TeamD are introvert. So most of us, including me, have the tendency to express our opinion less. But however, these difficulties also have improved significantly because we have worked on the basis of patient, persistent care, and mutual respect. And the last challenges is the lack of experience in telemedicine with all of us. So we seem to have no brainstorm idea for this problem, and we have handled these challenges by self-studying on the internet and discussing about telemedicine in each other. We spent, for example, in Japan, in Vietnam. Yeah. Next slide, please. And the last one that is is a summary. The first is there is a big gap in cancer care of medical staff between local facilities and central hospital. Therefore, there are many cancer patients have not received the appropriate cancer care yet. So our mission is to create the system offering online consultation and online lecture and app for medical staff to achieve the patient center care everywhere. And our vision is to shorten the gap of cancer care for patients through the telemedicine education for medical staff, especially in local facilities. And subjects will be involved physician, pharmacist, and nurse. And the last one is the initial difficulties in teamwork building is one of the most our challenges, but it is being improved significantly. And that's all. Thank you. And
Thank you.
our team also have a special time to own up member and tutors that because of your professionally and timely support during our team building work, the teamwork building. And we also have a special thanks to Mr. Michael Stanton for giving us your information as a cancer survivor. Thank you. That's all. Thank you. Yes.
Thank you very much for all the TeamD participants. I believe you did a good job, and now we are open to the questions and comments to the audience. So please.
One question I had was, so you mentioned that 7 out of the 9 team members were introverts. Was the team leader an introvert as well, or were they an extrovert?
So who will answer the question?
Maybe we did not decide the exact team leader, but actually I and Anna-san, who is who can speak Japanese and English to some extent, and we may lead the meeting in the most of the part. And we also are introvert personality, so I have to try, and yeah, I have to yes, boost my feeling.
And only 2 members of our team are extroverts. Yes.
Any other? Sorry, please go ahead.
I was going to say that this is a good point. You know, I think I'm an introvert as well, and it takes me generally a long time to open up and feel comfortable. But I think this is a perfect example of, you know, the personality type obviously sometimes does give you insight into how interactions might go and sometimes how you approach people. But, you know, just because you're an introvert doesn't mean that you can't step up and rise up to the occasion and contribute. I think sometimes it takes us a little longer, but, you know, never feel like if you're working in a group and there's more extroverts than introverts or vice versa, there's a place for everybody. And I think this is a good example of a team of, you know, 7 introverts who came together and did a great job working with their 2 extroverted teammates as well. So a good example of E&I's working together. Thank you.
Thank you, Melvin, for your comments. And any other comments or questions from the audience?
Can I make a question?
Sure.
Hi,
please.
This is Masami speaking, and I'm also interested in the same point as the Melvin said. So what did you, I was so surprised to hear that your team was 7 out of 9 are introverts. So what did you do for facilitating more active discussion?
So it's a question for mentors or tutors or participants?
First for participants.
Okay, so any participants will answer the question?
I want to ask a question. Yeah.
Okay.
As you say, I point out, at first we could not, a good discussion at all. Of course, because of the we are, or most of us are introvert, but also in the setting of the telemedicine and also language barrier. So at first stage, particularly the Japanese people cannot speak out or hesitate to speak. because the discussion was made in English. And so before the second meeting, we decided to hold the Japanese only small meeting in only Japanese and make a discussion in Japanese and lower the psychological safety. And we also decided to make a rule that we try to speak out both in English and Japanese is possible, or if we cannot speak English, Japanese is okay, allowed, and someone who can speak English and translate, someone who can speak English may try to translate after that. That worked very well after the meeting, and many Japanese speakers can make a statement much better. That's worked well, I think.
Thank you so much. You can all break the language barrier. I was so impressed. Thank you.
Can I make?
Sure, please.
Thank you. I want to speak out as a strong introvert person. First of all, maybe the brainstorm phase, the extrovert person is superior than introvert because they can speak out frequently. But I think introvert person can speak out adequately when the discussion deepens. So I think it is not so big problem. Introvert person is how to say majority of the team. I think that the diversity itself is a very important thing. So many person confusion is maybe the how to say important content of the team building. This is what I want to say. Thank you very much.
Thank you. So any other comments or questions from mentors and tutors of TeamD? I think the TeamD mentor and tutors, we spend a lot of time to discuss how to facilitate TeamD. So any comments from TeamD's tutor and mentors?
May I speak? This is Naoko.
And, please.
Yes, so thank you very much, TeamD members. I am very proud of being assigned to this team. And yes, as Kentaro said, at the beginning, everyone was very quiet, and I think that was kind of difficulty of speaking up especially in English. But the good thing I found was they try to listen to others, and they try to respect everyone's opinion. I found that was really good, and they really wanted to come to one idea. They really wanted to fill in the gap to solve the issue. So I think they worked hard to fulfill how they can fill in those gaps. And we learned, we have participants from Vietnam, and we learned that the difference between rural area and the central part, the resource is very different, and that motivated them as well to fill in those gaps. So so you overcome the different language barrier, and you learned from each other, and you created a great team. So congratulations.
Okay, thank you. Thank you. Because of a time limitation, so the last slide, and I would like to ask Kentaro, would you please show the last slide? That's a surprise for all of you from the mentors and tutors, because we know that this is our team. So we share that slide to all of you. It should be a blackboard. This is just show our feedback to all of you, because we know the team is not easy. But anyway, you can read that later because of time limitation. But I would like to say thank you to all of you from the tutors and mentors and use mother language to show appreciation and encourage to all of you. And also thank you all the mentors and tutors for provide your acknowledgements for TeamD members. Thank you very much. Thank you.
Thank you, Tony, for leading.
Welcome. My pleasure. Thank you. Okay. So, okay, thank you.
チーム C、カラフル、チーム D、エデュケアの皆様ありがとうございました。